core activation, my favorite shit. Here we are. We're going to start off by doing abs. Okay, today is kind of a more anterior chain dominant day. We did the rolling of the psoas earlier. Not that you should have done that earlier, but we did some stretching and opening of that area. Now we're going to activate it. Okay, so the first one, you're going to be laying on your back. This is a DNS exercise. I've talked about these a little bit, dynamic neuromuscular stabilization. What that means is we're trying to reteach your body and your brain to activate your core in a functional pattern, in a functional dynamic way. So when you go through these series of core activations, you're actually reteaching your brain to fire your abs the way they're supposed to, not just doing a bunch of sit-ups and crunches. Okay, this is how our bodies developed as children to be able to create a nice healthy core. So we're going to re-practice all of that. And you already have been if you've been following the video. So this is actually a progression in one that you've already done. Last week we did the 3-month supine position where you had your legs elevated as such, your feet just slightly higher than your knees slightly bowed out. Today we're going to progress into what's called the 6-month supine position where your feet are going to be higher. Okay, so you're going to bring your feet up a bit higher, not a bit higher, fairly higher than the one that we did last week. Now my knees are still slightly bowed out, okay, so they're not perfectly parallel with each other, but my knees are pushed out just a little bit. There's a slight external rotation of the hip. Okay, now remember last week we talked about keeping the low back flush to the ground. So that's something that we're going to reinforce again today. You don't want any space in between the low back and the ground. So I'm going to pull my rib cage down. Check this out right here. My rib cage is kind of flared up right here. If I think about pulling my pubic bone towards my sternum and pull my rib cage down like that, did you see that? Maybe not, okay. But what I'm doing is I'm thinking about doing see, the elevation of my legs don't change, but the core begins to contract and pull together, and that's going to push pressure into the low back through the ground, okay? So play with that. If you need to play with, okay, my low back's off the ground right now, how do I get it on the ground? Do something to be able to push your low back into the ground, and then more likely than not, your core is engaging in the right way. I like to also put my hands here off to the side of my belly button to feel that I'm consciously bracing, okay? Now that's just the setup position. It's going to get much more spicy here. So I'm then going to bring my hands just slightly out to my side, palms down, okay? And you know, you can go 90 degrees in the shoulders if you want. It's not super important. You can go a little bit lower. Now keeping the same angle in the knees and the hips, I'm going to let my feet just slightly fall to one side. So I'm doing this subtle little pendulum motion, keeping my feet the same distance apart from one another the entire time. I'm going to say about 12 inches, 1 foot apart. If you want to put volleyball, water bottle in between your feet to keep your feet that same distance apart, I'm cool with that. I'm pushing my hands through the floor to engage my upper back and shoulders. It's going to give me some stability. Now what I'm doing here is actually just a minute of this back and forth. I don't even want you to count. And I could already be at a minute, but I'm going to keep going. So if you haven't started yet, begin and time yourself for about a minute. Okay? Now things that you might notice, if you have tight hamstrings, your legs might be falling down here. It's okay that they're lower, but again, you don't want your low back to fall off the ground. Now as you rotate, part of the hip and low back is coming off the ground, that's okay. But you don't want to lose the core structure and the arching of the back that we maintained from the beginning. Okay? So be careful that your feet don't fall too far towards the ground. And if you're a pretty strong dude or lady, then you can actually challenge yourself with how far you go to the ground. And as I get down here, that's really difficult. You can see the trembling there. I got the hips working, the core especially working, some shoulder. So play with that for yourself. See what side can go a little bit lower than the other, because more likely than not, you'll be able to go just a little bit lower to one side than you did the other. And that's usually based on our handedness. What dominant arm are you? Because if you're used to throwing or grabbing or reaching with your right arm, what that typically means is you can rotate your shoulders relative to your hips to the left more easily. So then rotating to my right, because I'm not left-handed, if I rotate my shoulders to my right relative to my hips, that's a harder direction for me. So just notice that when you're doing that, and take it really slow. Do that for 1 minute, exactly. Now the next thing that we're going to do, we're going to get a 90-90 position, which we've been in before. Now this concept that I'm going to play with you guys is called Pails and Rails. Now we're going to do rails today. The rail term comes from the acronym in the functional range conditioning system, blah, 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 lots of words, right? It's a regressive angular isometric load. Okay, so basically what that means is we're going to get into a stretching position, which is 90-90 today. I'm going to lean forward, and I'm going to feel this stretch in my right glute. Okay, you guys have been here. Last week we were in this position. But today, we're going to activate psoas, core, groin, and some hip to try to lift this knee off the ground. Okay? Now, what does that look like? Sounds a little crazy. It's certainly going to be difficult. Now, what's really important to consider here is how low your chest is towards this knee and how active your spine is. Last week, we were rolling around like this with a not active spine. In previous weeks, we stayed active as we bent forward. So what you're going to think of today is actually staying active. I'm staying tall. You can see that my back is very flat and engaged. I can actually use my hands to push into the ground. Now I'm going to lean forward a little bit. Okay. This foot is active. Knee is at 90. Hips are at 90. 90 here. What I'm going to consider now is lifting this knee and leg off the ground. And I'm going to try to do that simultaneously, so this angle of my leg is going to stay the same. So my foot and knee lift at the same time. Now, sometimes what happens is the knee will lift, but the foot will not. Okay, not typically the foot then the knee, but this happens a lot. Now, what I'm going to do is I'm going to show you, I'm going to lift the entire leg, and it's not going to be perfect. The knee will come a little higher than the ankle. I'm going to take a huge breath. Push down on the hands, and I'm going to hold. Now that was just a few seconds, because a few seconds is all that's necessary. Now the camera angle came in front so you could see this is happening. What you didn't notice is that my posture stayed. That's really important. I can lift this knee, but if I have to hunch down to do it, like so, if I do this, look at my back. I'm rounded, my upper back is coming forward, my shoulders are coming forward, and the angle here in my leg is changed, then I don't want you to do that, okay? So if I keep my back flat, lean forward, push down on my hands, and then I try to lift, sometimes, for some of us, the leg will actually not even come off the ground. And that's okay. That is totally okay. All you're trying to feel is that you're working in this area to be able to activate and eventually lift the leg off the ground. So if I go more forward here, hands still supporting, I'm going to try to lift the leg. Now my leg is not lifting, but I'm working super hard. I'm trying to lift the leg, and I feel all this engagement deep within my hip. And I'm just going to hold that for about 10 seconds. Okay. Now, I'm not faking that, I promise. You don't see anything happen because it's an isometric load. Regressive, angular, isometric load. That's what a rail is. So, what you're trying to do is get in this position, and it's kind of confusing, it's kind of a lot. You're going to lean forward to some point, find where you get a little glute stretch, keep your posture. You're going to try to lift this leg off the ground, and it may not, and that's okay. Just try to feel this work here in the hip. Hold it for 10 seconds. And then relax. Okay, you're going to do five sets of that 10-second lift. Okay, now I've only just done 3 on this side, but you're going to do 2 more. If you need to press pause, because I'm going to move to the other side, then go ahead and do so, but complete 5 on each leg. So I'm going to go on to the other side. I'm going to talk less and exercise more. There's a lot of explanation in that previous side. I'll keep it minimal here. Tall, lean forward a little bit, push down on the hands. I'm in all the right angles. Take a big breath. Try to lift. Now my left hip is much weaker in this position, so I'm getting next to no lift in my foot. I'm only just barely feeling this activation in my hip, but it's still hard. You can see that my knee wants to lift this way, but my foot doesn't want to come off. So I'm making sure that my knee doesn't come here while my foot is staying down. I'm thinking about lifting my foot and my shin evenly off the ground. So that was 1. I'm going to do 4 more. Okay. If you need to take a breath in between, go ahead and do so. You should be really working hard here, okay? It doesn't look like much, but you're trying. There's a lot of effort involved. Breath in, lift. I can feel better and better activation as I go along, because that muscle, the area, is beginning to turn on more. Now, a lot of us, when we get in this position, we start to feel crampy in our back leg. If you got to swing around, take that leg out for a couple seconds, go ahead and do so. Give yourself a little massage here with the knuckles. Finding that cramp, massaging it out, go ahead and do so. Then go back, make sure you get the 5 reps. I'm going to do 2 more. We're really going to fight. Now my leg is actually coming off the ground. Barely. Okay, I got 1 more. This is called functional range conditioning for a reason. We're finding our end range. We're conditioning the hip in this end range in a way that we never have before. And then when you're working in these end ranges, it ends up being conditioning because we've not done it. It's hard to work in our end ranges of motion. But this is what really creates true mobility in the joints, in the hips, in the shoulders, wherever we do it. Last one. I don't even know if that was 10 seconds, but it felt like forever. So if it was 7, guys, give me a break. Okay? All right, so we got 1 more exercise to maintain. And this is a hold, so it's not dynamic, but it's super engaging. We're going to get into a tall kneeling position. We're going to bow out our knees just a little bit, keeping our feet closer together, and your toes are going to remain under your shins. So not let loose like so, but pull them under. Now what we're going to do here is we're going to align our pelvis by doing a little pelvic tilt. And what that means is, if you look at my back is not arched here, but I'm going to pull my rib cage down and squeeze my glutes forward. Okay, so it's important that you see in this position that, again, my ribs are not flared up. We talked about this earlier, but my ribs are pulled down. Okay, I'm locked here, and then I'm also squeezing my glutes forward. So you're keeping this engaged pelvis position. It's called posterior pelvic tilt, not anterior pelvic tilt. So posterior pelvic tilt. Now, keeping this engagement here, think of having a ball in your hands and you're squeezing. You're really engaging all the way to your fingertips. If you're going to grab some heavy basketball or ball of some sort, engage the fingers. Bring the fingertips together. Reach the hands, fingertips, arms out in front of you as far as you can. As you do so, watch my hips. My hips go back and down as far as they can go, keeping the heels, feet together. Now there's going to come a point where you can't reach your arms any further, you can't lower your chest any further, and you can't put your hips back any further. This is the point where you hold. So I'm going to keep my hands out. You can see my arms are straight. Watch what I do with my head and neck now to align my neck. I'm going to close my jaw, mouth, pull my chin back to make a double chin. That's a happy aligned neck. I'm tightening my abs. And if you were to see my breath, I'm going to hold this for 1 minute. So get in the position, join me. Your arms should be parallel with the ground, not lower, not higher, parallel with the ground. I'm going to do 20 more seconds. Okay, so we got 3 exercises there for the core activation sets. You're going to do at least 1 more set, maybe 2 more sets, depending on the intensity you're going for today. So good luck. Hope you're already warm. If I'll see you in tier 3, then we're headed there next. Complete those next 2 sets and then join me.